Good evening. I'm Betsy Rosini, Associate Dean of the Feliciano School of Business, and I'm delighted to welcome you to this evening's conversation between Robert Garrett, CEO of Hackensack Meridian Health, and Steve Adubato. Bob is the steward of New Jersey's largest health network, comprising 18 hospitals, 500 patient care locations, a school of medicine, affiliated nursing programs, and 36,000 team members. Hackensack Meridian's hospitals, treatment, and research centers are top ranked, and under Bob's vision and leadership, the network will soon include a state-of-the-art mixed-use and transit-oriented development project in Islin, new surgical and critical care towers, and 24 new ambulatory care centers located across the state. Bob's focus is global as well as local. He serves as chair of the World Economic Forum's Health and Healthcare Governors Community, a group whose mission is advancing healthcare availability, patient-centric treatment, and improved healthcare outcomes around the world. Earlier this month, Bob received the New Jersey Chamber of Commerce's Thomas H. Kane Senior Business Leadership Award, just the latest of his many accomplishments and acknowledgments of his talent and contributions. We are thrilled to have him here today to share the story of his journey and offer his insights about the future of healthcare. Bob's partner on stage.
Oh, sorry.
You can clap.
Was that the wrong time?
It was the wrong time. It's okay. Bob's partner on stage this evening is Dr. Steve Adubato, an Emmy-winning television anchor and author.
Let's go.
Bob, stop. That's just gratuitous now, Bob.
Steve has appeared on NBC's Today Show, NPR, CNN, MSNBC, and CBS as a media and political analyst, and is the host of Steve Adubato's Lessons in Leadership with Mary Gamba, based on his popular leadership books. Steve is also, and maybe most importantly, a Montclair alumnus, and we're always very happy to have him back here on campus. Before I turn this over to Bob and Steve, I want to thank everyone who provided questions for our speakers in advance. And at the end of the conversation, we'll have our Q&A session. And since some of you have 6:55 classes, at approximately 6:45, we'll pause and allow you to depart quietly. We'll then answer any remaining questions from the audience. So now please join me in welcoming Bob Garrett and Steve Adubato.
Thank you. Thank you so much to everyone who has come here tonight, of the students from a whole range of programs, areas of study, people about to graduate with an MBA in a few months. To those of you who are about to graduate, congratulations. To those of you who have a journey ahead of you, I'm excited for your future. I will tell you that I said this to President Coppell before and to others. I have a master's and a doctorate from another lesser university, starts with an R. They wear red as well. But I am most proud of my affiliation with this university. Back in the day, as they say, it was a college, not a university. This building wasn't here. A lot of buildings weren't here. The reputation of this university across this country, particularly in certain fields, public health and business, other areas, media, communications, Jonathan, extraordinary. The two leading executive producers of our PBS production company came from this university in a class I taught 15 years ago in media and journalism. I knew immediately they were the best of the best. I gave them A's in an effort to make sure I could hire them later. And they have come to run all of our major productions. This university puts out the best of the best and make meaningful contributions in a whole range of areas. So in that spirit, Bob, let me ask you this, which is not part of any of the questions here. Your college experience, okay, influenced you how to become the healthcare leader that you are today?
Before I get to that, I do want to thank Betsy for that great introduction, number one, and I want to thank President Capel for having us here. This is a great series, and I just want to I also want to say how proud I am to be here. You know, when we have institutions like Montclair State University and Hackensack Meridian Health, we're really blessed in New Jersey because these are great institutions. They got a great history and really a great future. So again, congratulations to all of you for being a part of it. It's really a pleasure being here. Now college, right? College.
Where'd you go to school?
Where'd I go? Binghamton University, actually, upstate New York. We actually have a little partnership going with them now in pharmacy. You know, I don't know if this is a relevant story, but it is a little bit about leadership. So my first elected position in life, because I kind of blossomed late in life. I started blossoming a little bit in college. I was actually elected for my dorm in college, the keg master.
And you're proud of this, Bob?
Yeah. Well, you know, let me just say, you got to start somewhere, and let me just say how this works. So my roommate in college, he was elected president of the dorm. I was elected the keg master. So we basically, you know, had the whole social thing going. You know, you got the parties, you got the beer, you got everything like that. So there was a little leadership involved with that because, you know, first of all, you had a campaign for it. You had to earn it. You had to get elected. But it's what you did with it that was important. And in those days, that was important. But let me be a little more serious about college. You know, I think, you know, college was a time where I think I really started to focus about my future. And to be very frank with you, when I started school and even during school, I didn't know what I was going to do. I was a political science major. And by the way, I don't know if any political science majors here, but let's go. Poli-sci. It was, thank you. And Jonathan in the back there. Yeah, thank you, Jonathan. It was a great major, but I really didn't know what I was going to do. So I kind of had a little bit, my family put me through a little bit of an intervention. So there was a family friend, her name was Sister Mary Jean Brady. Yeah. And so I guess I was probably a sophomore in college at the time, or a junior, I forget. And she came to my house. It was during one of the breaks at college, and she came to my house, and she was, and those days they called them administrators, now they're called CEOs. She ran a major hospital, Mercy Hospital in Rockville Center, New York. And I think why it was an intervention is I think my parents wanted me to get to know her better, because they were thinking, where's this political science major going to go after school? He needs a little bit more direction, a little bit more focus. So I started talking to Sister Mary Jean at my parents' house, and she invited me to do a summer internship at Mercy Hospital in Rockville Center. And I kind of fell in love with healthcare at that point. You know, I spent the whole summer under her wings. We rounded through all the departments. I understood how hospitals worked. I also understood that the patient really was the center of everything that we do, no matter what your job is in the institution. And I had a real focus. I mean, so, you know, I think, you know, I kidding around about the kegmaster story, but that certainly was some lessons learned there. But my intervention during college with Sister Mary Jean was phenomenal, and it inspired me actually to go back and get my master's degree. It was an MHA, Master in Healthcare Administration, at Washington University in St. Louis. And then I came back east and did a residency program, a postgraduate residency program at what was Hackensack Hospital. And the rest was history. So it really did start in college with that intervention and those great memories from being a kegmaster. Sorry to say, but it is what it is.
So kegmaster, let me just say this, Bob. It's so interesting.
He wants to go back to the kegmaster.
No, I'll tell you, I was saying this to Jonathan. Our younger son he's a leader in his fraternity up at Syracuse, and he ran the keg department as well there. And we had an intervention recently with him as well. And so he's actually leaving Syracuse and coming to Montclair State. He's actually a student here. He'll become a full, well, because he has to, because he's the keg master up at Syracuse.
Do they have that position here at Montclair?
It is, Jonathan has assured me if there is, it's much more manageable and leadership-centric.
Sorry, Jonathan.
No, in a good way. But, Bob, I want to follow up on that. And I met Bob about 15 years ago, and I should also disclose that, and I said this in our earlier meeting, Bob and I talk leadership all the time. We talk communication and leadership all the time. I am very much involved in the Hackensack Meridian Health. It's a physician leadership academy that I do coaching and leadership and teaching in. And Bob, I have to ask you something about this. You mentioned Sister Mary Jane
Right.
Brady.
Brady. Right.
Relationships. Our relationship with other key leaders at HMH, the relationship being developed with Jonathan and many of the deans and the leaders here at MSU and the students. The relationship I developed 15 years ago with 2 students who are now executive producers in our production company. Connect. Intentional relationship building with leadership and career development.
I mean, relationships are such an important part of leadership. Again, if you think about it, relationships are such an important part of life. Whether it's your personal relationships or your professional relationships, so important. I mean, I don't care what business you're in, what organization you're with, you can't, it's never a one man or one woman show. It is always about teamwork. It's about developing relationships, developing partnerships to really lead. That's the way I've always felt about it. I think if you look at successful leaders through history,
Right.
It's always about the relationships that they build, the partnerships that they form. Those that kind of tried to do it on their own, I think, maybe they're successful for a short period of time, but I don't think it builds long-term success. Relationships are also important to build a great culture in any organization that you lead. That's so important, and it really starts. I feel it's a responsibility of mine. My title is CEO, but I also think of myself as the Chief Mission Officer because I have to continually communicate the mission of Hackensack Meridian Health to different groups and to our own team members. Also consider myself the Chief Culture Officer because I have to set the example for the whole organization. So how I conduct myself, how I enter into relationships, how I partner with people, that really sets the tone for the entire organization. So I can't say enough about relationships. Again, we talk about it in our personal lives a lot, but we don't talk a lot about it in terms of how important it is for leadership and how important it is for organizations to be successful.
Let me push you a little bit on that. How many, by a show of hands, put your phone up. Who has a phone? Put your phone up. Put your phone. We're not going to take a group picture, trust me.
Yeah.
Overrated. So here's the thing. You and I are old school that way, which is another way of just saying we're old. So here's the thing. For students here at MSU, who, let's just say, like most of us, you spend a fair amount of time, by a show of hands, how many people more than 2 hours a day, you don't even know what the question is, you have your hand out there, it doesn't matter. You're just saying, okay, 2 hours a day, scrolling, searching, looking, texting, 2 hours a day. Okay, I'm not going to go up from there. Here's the question, Bob. For students here at MSU who are smart enough to choose to be here tonight, relationship building is not going to be replaced by AI. It is hampered sometimes by technology. It is also enhanced at times by technology. Both of us, in terms of relationship building, learned a different way. What advice do you have? Not one of the prepared questions, sorry, Mike and Mary Jo. What advice would you have for students today as it relates to building relationships in a very digital age?
I would say, and, Steve alluded to it, through digital platforms, you can still build positive relationships.
Yes.
So I would focus on the positive aspects, use technology to build those relationships, because relationships today, you're absolutely right, we are kind of old school. We didn't have that technology when we started out in our careers, so we had to do it the old-fashioned way. And nothing wrong with the old-fashioned way. I still think that's really important. But let's be real. The realistic, student today coming into the workforce, is going to use a lot of digital technology, and I do believe you can use that very positively to build relationships. I would never advocate using it for anything negative. I mean, I know that there's a lot that's
Yeah.
been said about negativity with social media and digital platforms, but I do think it can be used very, very positively. It can help to build relationships. And listen, we've all had to adopt, even us old schoolers.
Yep.
We've had to adopt, and our relationships today are based on personal relationships, on face-to-face relationships, but they're also built on digital relationships. Nothing wrong with it.
Nope.
I would embrace it. I would accept it, but I would keep it as positive as possible, because I think there's a lot of potential. There are a lot more people that you can relate to today because of that.
Faster, too.
Much quicker.
Bob, should I do this? See, Bob and I have, again, 15 years together, worked together, friends, collaborated. Bob will not admit that I've coached him at times.
Yes, I will admit it. I'm not saying what kind of coaching. No, I'm kidding.
No.
No,
But here's the
he
thing.
actually, you know what? Not just because he's here, but honestly, you can't find a better coach. And Steve, what's great about Steve, where you get to be like CEO of an organization, and people around you, like they don't tell you how you're really doing sometimes. Steve has no problem with that. So if I'm trying to prep for a speech or whatever, and he goes, Bob, you just gave up that line. We couldn't hear a word you said. I mean, he'll say stuff like that. He's in my face. New Jersey, right? New Jersey in your face.
Oh, do we have an attitude?
A little bit, Jersey direct, right? But I love it because, first of all, it grounds you, but it also, I think no matter what level you are, no matter what your position is, you do need that kind of coaching.
And to Bob's point, two things. I'm going to follow up on the coaching and the receiving feedback, no matter what position you're in, because I'm obsessed by this recent book I wrote that I'm so uncomfortable plugging. It's called Lessons in Leadership 2.0, The Tough Stuff. There's a chapter on feedback. But Bob and I use technology today to actually deal with a very sensitive, difficult issue. You don't even know about this. I texted Bob and I said, Bob, are we wearing ties tonight? Literally. And he said, let's be casual. And then we found out the president was wearing a tie, and we said, yeah, okay, we're wearing ties. So it has its place, but let's go back to feedback. Bob was talking about coaching. I have this idea. Now, you know what? I don't know if I call it an idea. Definitely not a theory. There's a perception on the part of some that younger people are harder to give constructive, honest, hard to hear feedback to. What's the smiles? Are you shaking your head? You know what I'm talking about? Because this is the perception on the part of many, that for too long, they've been told how great they are. I tell our kids that all the time. I have 4 kids, and then when I have to tell them something hard, they said, I thought we were great, Dad. Yeah, but this thing you need to work on. And I'll just speak, it's unscientific. I have 4 kids who push back all the time. Question, how important is it to be receptive and not defensive to constructive, honest feedback about your performance, even if you don't like it?
It's huge. It's huge because if you're not receptive to feedback, you're not going to progress. You're not going to grow as a leader or as an individual, as a person. I think it's really, really important. Listen, I have two sons, and we do the pushback back and forth on a bunch of issues. But honestly, I've tried to always be as transparent as I can with them. Obviously you want to be supportive, and as a leader, it's very important. Part of your role is to coach and to be supportive, but not to the point where you're misguiding somebody or you're really covering up something that they should really be hearing about. I'd rather be told, honestly and transparently how I'm doing, how I can potentially improve.
Sure.
Not everybody can take that kind of constructive criticism, but if you're really going to progress as a leader, I do believe it's so important. And I tell my team all the time, do not be afraid of coaching. I mean, I've had most of the executives at Hackensack Meridian have some sort of coach, a professional coach, somebody that helps them on different aspects of progressing as a leader. And everybody who's had coaches say it's great. It really helps them in so many ways. I've had a couple over the years that have said, hey, that's a sign of weakness. If I take a coach, it shows that I'm really, I'm really weak. I can't progress. I know everything. It looks like, I'm too high up in the organization to have a coach. And then I say, well, listen, I'm the CEO. I have a coach. And
Tiger Woods had a coach.
Exactly.
So that means the rest of us can have a coach.
Correct.
Right?
I think so. Yeah.
Yeah.
It was good enough for Tiger, right?
Good enough for Tiger,
Yeah,
Michael
good enough for
Jordan,
me.
others. But here's the funny thing about what Bob's saying. And again, I am obsessed about this feedback thing because I believe that it's not only difficult to receive it, it's very hard. In my coaching, half the time it's teaching people to give. Honest, constructive, hard to hear feedback. There's a chapter in a book I wrote a few years ago called Great Leaders Sometimes Piss People Off. And the quote comes from General Colin Powell. I did an interview with him and I asked him, General, what's the most important leadership quality? And he said, Steve, there's so many. And I said, but what's one that doesn't get talked about? And he said, the greatest leaders are willing to piss people off. I said, well, why would they want to do that? And he said, they don't want to do it. They do it because it needs to be done for that person to perform better and for the organization to succeed. And for those leaders who are not willing to do that because they want to be liked by everyone all the time, that organization will never be at its best. You say?
I say absolutely correct. Colin Powell's 1,000% correct. And one of the things that every organization deals with, and we deal with it at Hackensack Meridian Health too, when it's time for annual evaluations of leaders, we tend to have a little bit of what they call, I guess, grade inflation, because nobody wants to necessarily give that.
At MSU, that does
honest,
not happen.
That never, right? Nothing like that. But no, but honestly, sometimes that happens because of the phenomenon that you're talking about. That people don't want to give the feedback.
Because?
I think they just, people just, they have a tendency to want to get by, want to be liked, and you know what? They're really not doing that individual a favor. So
or the organization.
What we do, or the organization. So what we do is we calibrate all of that. If I see that there's that so-called grade inflation and everybody on a scale of 1 to 5, everybody's getting a 5 in every category, I will push back and say, okay, give me some examples as to why you're scoring this person a 5. Now listen, if the person deserves a 5, absolutely, 1,000%, and they should be recognized and rewarded for that. But I do think as a society, we tend to want to kind of skate by sometimes and not give that honest feedback, but it doesn't do that individual any good. As a matter of fact, it can be harmful, and it doesn't do the organization any good.
Bob, COVID, you and I have talked about this on the air many times, and it may be the answer to the question, it may not be. But identify an incredibly challenging, difficult leadership situation you and the organization you lead faced, how you dealt with it, and what you learned from it. It may or may not be COVID.
Yeah, I mean, COVID is something that I want to continue to always talk about. A lot of people say, well, it's, years ago, it's in the rearview mirror. It was 5 years ago since the first COVID patient was diagnosed and treated in New Jersey, actually at one of our hospitals at Hackensack University Medical Center. But the reason I want to continue to talk about COVID is because what our women and men did on the front lines of healthcare should never be forgotten. They are truly American heroes in my view, and I think when the final books are written about the COVID era, they will go down as heroes in history. They sacrificed so much. In many cases, they sacrificed their own lives for what they did. So I never want to forget that. So when I start talking about COVID, I always want to give a shout out to our team, our healthcare team, because they were amazing. And by the way, not just at Hackensack Meridian, but healthcare teams all over the country and all over the world for that matter.
How did it impact you?
What's that?
How did it impact you?
So
as a leader,
it impacted me so significantly. Let me give you a couple examples. You asked about a challenging moment during COVID, and one that comes to mind. I mean, there were so many. I mean, we were literally working around the clock. We didn't think about it back in March and February, March of 2020. We didn't have pharmaceuticals. We didn't have therapies to treat COVID. We didn't have vaccines to treat COVID. No one understood how the disease was spreading. There were rumors, each day by the hour. There was so much uncertainty, and that kind of uncertainty, as leaders, we're not always used to. But I think what it taught me more than anything else is how important teamwork is, because people stepped up like I've never seen before, and teams really came together. And even if it wasn't remotely close to one's job, they stepped up and said they were willing to help. I mean, I saw incredible feats during COVID. We up at Hackensack University Medical Center, as an example, Steve, our plant operations team, within 3 days, converted a huge cafeteria into a major patient care unit in ICU. I mean, they literally did this by working around the clock in 3 days, because Hackensack University Medical Center was overwhelmed with patients. We saw nurses traveling almost 2 hours a day, coming from Southern Ocean Medical Center to help their colleagues up at
One of your
Hackensack.
hospitals.
We saw patients going from Hackensack down to places like Southern Ocean Medical Center because the north got overwhelmed quicker. But the most challenging story that I do want to share with the group today is there was so much happening at one time, and you had to make decisions on the spot. So early on in the pandemic, we started to get some scientific evidence that there was huge community spread. COVID was spreading through the community, and that was starting to be proven out. So we had an adequate supply of the personal protective equipment, the PPE, and we made a decision to save lives right away. We required all of our caregivers and everybody that entered into our hospitals to wear the protective masks, because the first month or 6 weeks of COVID, they weren't wearing those protective masks. Now, there was a shortage going on at that time of the protective equipment out there. So when I made that decision, I got pushback from other hospitals. I got pushback from the Hospital Association of New Jersey. They said, Bob, if you do this, that means we're all going to have to do something like this, and we may not have all the equipment, all the supplies that you have.
You might piss them off.
I said at the time, our job is to save lives. And you know what? Within 2 or 3 days of me making that decision, every other hospital in the state of New Jersey made the same decision. And by the way, we also gave some of those hospitals that were in short supply some of our supply. Some competitors, the equipment. So that was a very tough decision, because I got so much pushback from the industry at the time. But you know what? I told my board, and I'll tell the group here today, if I was faced with the same decision to make today, I would do the same thing. Even if it saved one life, it was worth it. But I know it saved a lot of lives.
But it's interesting. I started out by talking about that quote from General Colin Powell: "Great leaders sometimes piss people off." I am sure that's exactly what you did with some of your colleagues, with the healthcare establishment, and that was a part of your decision making, but not the predominant factor in your decision making. It was what you thought was right. I'm going to follow up on this because COVID and we were having this conversation earlier, and we'll continue the conversation with your leaders here at MSU as it relates to community and public health in terms of vaccine awareness and education. Let's just say this. Wellness. I'm going to ask you a bigger picture question, but I want to get this one. In the Hackensack Meridian Physician Leadership Academy, we have a module that actually talks about creating a culture of wellness and the connection between wellness, well-being, and leadership. You, and it's important we share this with everyone here, your connection between your wellness, your well-being, and your work as a leader, and why is that relevant to everyone here at MSU?
So it's so important, you think about wellness, and there's different ways to phrase this,
right?
But I think it's about kind of a work-life balance. So I've always been a big proponent of having a really balanced work-life situation, because if you're going to be an effective leader, you need to be as physically fit as you can be, and you need to be as mentally fit as you can be. I've always told young people coming up in our organization, don't miss important events, whether it's your children, your parents, friends, spouses, whatever. it is. Do not miss those. We'll figure it out. We'll balance it with what's going on at work. You might have an important meeting that you have to attend, but I know when my kids were growing up, I tried to get to all of their important sporting events, any of their important plays that they put on at school, and anything big like that. It's important that we keep that work-life balance, because that makes you a more effective leader, because you do need your time with your family, with your friends. Relationships, as we talked about earlier, are important, not just at work, but relationships, with on the personal side are so important. In terms of nutrition and exercise, I'm a big believer that that's an important aspect of being a good leader too. And on the nutrition side, I really have had no choice, since my wife is a nutritionist.
Yes, she is.
I am kind of forced to eat the right foods, but it has served me very well, I think.
Hold on one second. Didn't President Coppell say before we're leaving, Bob, you're into nutrition, so why don't you have a cannoli before we go in there? Did you not, Jonathan? You did. Now, is a cannoli the exception? What did you say? That's a New Jersey vaccine. That's a good one.
It is a kind of a Jersey thing, though, cannoli. But I do believe in in eating right. And as a healthcare leader, I think you have to set that example as well. But also exercise, really important as well. I think however you do your exercise. For me, I try to get to the gym several times a week. I do have a personal trainer. You don't necessarily have to have a personal trainer to stay in shape. I do, for two reasons. Number one is because I have to work out at like 5:30 in the morning. It's the only time that I really have an opportunity to get a good workout in. So if I didn't have that personal trainer waiting for me as an appointment, I know what I would do is kind of turn over in bed, especially on these cold winter mornings, and not get out and exercise. So for that reason, I have a personal trainer. And the other reason is they keep you safe, because we all tend to do kind of stupid things when we're working out or exercising, and we injure ourselves sometimes. And I think the personal trainer kind of keeps you safe. But you don't need a personal trainer to stay in shape. So I do think, to your question, though, I think that work-life balance is really an important part of being an effective leader. I have seen so many people around me as leaders perform so much better because they do spend the time with personal relationships. They do spend the time thinking about their own health, thinking about their own well-being. And honestly, when you're a leader of an organization, you have not, in our case, we have 36,000 team members, but we also have their families that are counting on us to perform at our best. So I have a responsibility also to be at my best, whether it's through exercise, nutrition, personal relationships. I need to be at my best at the job, because so many people are counting on me and my team to get it done.
And let me just say this, that wellness and well-being is defined in so many ways, and sometimes people narrowly define it as fitness and nutrition. That's a piece of it. But I will say this, for me, how many people, I've had a terrible habit. I'm messing around on this phone late at night, and then I have dreams that I don't understand. How many people, and MSU is all about honesty, right? How many people are looking at their phone before they go to sleep? Hands up. You did?
A little bit, yeah.
My wife said to me the other day, there's a blue light coming off there that's messing with your brain. And so I said, what do you mean? She goes, well, it has to explain some of the things you say in the morning, because I don't know what's going on. Here's my point. I have made a concerted effort, and I'm not doing well with this. My wife said, instead of the phone at night, read a book, and it'll put you to sleep. And I said, well, what do you think? And she said, I've been reading your book for months, and it puts me to sleep. So I wish that were a joke right now. And I read my book, and it put me to sleep. Bob, don't say that. Don't go there.
I was just going to say, I could use a good night's sleep tonight, so maybe.
It's on your bed. I know it's somewhere there.
It's somewhere.
Okay, let's get serious.
Yeah.
How about this one? President asked you this.
By the way, just one more thing about sleep. I used to say in my my talks out there, the HMH team works so hard that we think sleep is overrated, but my clinical colleagues said, Bob, that's the wrong thing to say.
Yeah, don't say
because
that.
Sleep is not overrated. It is important. So I want I want to stress that too, because
Yeah,
that is
some of us
important.
believe you'll sleep
Whether,
when
whether
you're...
we read your book or not, we need sleep.
But it does help.
Yeah.
That, my wife said it's better than melatonin. But hold on, real quick follow-up. The president asked you this earlier. Top 2 challenges for you as the leader of the largest healthcare hospital system in the state, the 2 top, and I know there are many more, but pick 2 for reasons of time, that, quote, keep you up at night.
Yeah, I mean, there's a lot of challenges right now in healthcare. I would say, and, you know, we talked about this a little bit before. The first thing I would say is there's really an attack on funding right now, particularly Medicare and Medicaid. It represents, and we're not unusual at Hackensack Meridian Health, but it represents close to 65% of all of our revenue that comes in from the government through Medicare and Medicaid. So many senior citizens, so many vulnerable and poor people in New Jersey and beyond count on those programs, and they are under attack right now. So that does keep me up a little bit at night, because, you know, we're fighting to at least preserve Medicare and Medicaid funding at the level that it's at now. But, you know, we're only one voice. We're a large organization in New Jersey, but there's a lot of winds blowing the other way. So that's issue 1. Issue 2, I would say, for me, is workforce shortages. And, you know, that's been a persistent problem, whether it's physician shortages, nursing shortages, other healthcare professionals. You know, at Hackensack Meridian, as we talked about a little bit earlier, too, we have a school of medicine,
That's right.
First new private medical school in New Jersey in over 60 years. And that has been very successful in recruiting and retaining the best talent to New Jersey. We do have a shortage of primary care doctors. I don't know if everybody knows this, but 1 out of 3 New Jerseyans and 1 out of 3 Americans don't have a primary care doctor. And, you know, there are different ways to really address that. Certainly having a medical school that's focused on primary care and on prevention, I think, is one way. You know, we talked about, you know, digital platforms and technology before. You know, a lot of people are comfortable receiving primary care through virtual means. And
Telemedicine?
Yeah, telemedicine. We have a new program called HMH 24/7.
Yep.
And what it is a group of primary care physicians that anybody can connect with through telemedicine. And it's really great because it's AI powered, so it helps you to get to the right physician, to the right specialist if you need a specialist. And, you know, so there's different ways to attack it, but there's definitely a workforce shortage that has happened in healthcare. It's not getting any better. So, you know, partnerships like one between Hackensack Meridian and Montclair are going to be important. You know, we have partnerships with other schools. We have our own schools, the School of Medicine. We have nursing schools within Hackensack Meridian Health. We need to also use technology and embrace technology. I'm really excited about one program that we've already embarked on and that we're going to expand. It's called virtual nursing. And through technology, nurses are actually helping their colleagues at the bedside with some of the administrative tasks that keeps bedside nurses away from direct patient care. So think about it this way. A virtual nurse could be anywhere in the world and can help that nurse at the bedside with admission, doing admission forms, doing discharge forms, doing medication reconciliations, whatever is keeping that bedside nurse away from the patient. They can supplement what that nurse is doing on the floor. So I'm really excited about embracing technology to deal with the workforce shortage. But I would say those are 2 of the biggest issues are the funding issues, you know, reimbursement issues that are out there. We're going to have to really fight hard for this one. And secondly is the workforce shortage.
Stay on the workforce issue. Who are by show of hands, the MBA students? Hands? Community health? That's some community health. Yeah. Who are the other students in what other areas? Hospitality. Finance. Management. Well, so you're not an MBA student, but you're in the School of Business. Yeah. Business analytics. Okay. So regardless of what any student here at MSU is studying, those here tonight, the career advice question can be so predictable and unproductive, but I know it won't be with you. What tangible, practical advice do you have for the students here as it relates to preparing themselves to leave this great institution of higher learning and go into the marketplace,
Well, first of all,
particularly in healthcare?
Yeah, first of all, I think you're fortunate going to a university like this. I think the programs are excellent. I think you certainly have the background and the college experience that you're going to need to succeed. I would say this, Steve, more than anything, is agility and flexibility. Be a little bit flexible. So, the world is changing. Technology is certainly advancing. Artificial intelligence is going to change a lot of industries, including healthcare, over the next few years. So no matter what your major is or how you're leaving Montclair, be flexible in terms of the types of jobs that you're looking for. Healthcare, as an example, I mean, I happen to think that having dual expertise is going to be really, really important. So as an example, you could be an MBA student and have some good healthcare financial background, but if you have some legal background or you have some clinical background, whether it's a nurse, physician, or maybe you're a pharmacist by trade. I mean, it could be a lot of different areas. Utilize that to the fullest. I think, as I think about healthcare, when I started, it was really a very hospital-centric, but more and more healthcare is being delivered outside the four walls of the hospital. So we're, as an example, Hackensack Meridian, most of our healthcare is being delivered in ambulatory care sites at home, hospitals at home. So I think that we have to be agile. We have to be flexible. We have to think about maybe skill sets that weren't important before. Because with respect to like ambulatory care as opposed to hospitals, ambulatory care is a knowledge about real estate. It's a knowledge about how to get projects approved through municipalities, as an example. That type of skill set's going to be important. It's about partnerships, because a lot of these ambulatory care sites out there are partnerships.
Relationships.
We're back to relationships, right? We came full circle. So I do think, being flexible, being agile is going to be important. I think your education here at Montclair certainly gave you those skills to be agile, to be successful. And I got to tell you, I'm an optimist by nature. I think there's a lot of challenges out there now in the world, in the country, around New Jersey, wherever. But I got to tell you, I think with technology expanding the way it is, with the development of healthcare in particular, moving in different directions, and the diversity in healthcare that exists today, I really think that the future is bright. So I'm actually very optimistic about the job market going forward. So hopefully you'll all succeed, but try to think about being a little bit agile, a little bit flexible, not as maybe not as set in a particular area as you might have thought about in the past.
Well said. I know that students do have, whoever's going to class, I know you have a deadline. That's when you have to go to class. Of course not.
Yeah.
First of all, again, this was absolutely incredible, amazing. I wish we could have many more hours of listening to you guys discuss this, because I think these are really very relevant and informative for all of us. I know some of you out there do have a 6:55 class. That's our new time of our classes, by the way, if you guys know. So what we were going to do is stay put for the moment. For the students who've got to make, especially the undergrads who need to get to a 6:55 class, we're going to politely, quietly move out of the room. And then we could kind of stick around for maybe another 10 minutes, and we'll have a Q&A for those who are able to stick around a little bit. So we'll do a pause in a moment. But before that, I do want to officially give you a token of our appreciation.
Can I get my diploma?
So we do have a crystal plaque here for Bob Garrett, that as our
That's yours?
speaker
There you
here.
go.
Yes, this
Yeah.
is a
Thank you
nice,
so much.
plaque that we have
Appreciate
for
it.
you.
Thank you.
And we also have some nice gift bags for
Oh,
you.
thank you.
And this is for you, Steve. Yes, your diploma's inside there.
Thank you so much.
I went to do a little photo.
Thanks.
Yeah. Thank you. great.
So,
Once
I'm
again,
sorry.
at this point, what we could do is, for those who really got to take off to get to class, we're going to politely excuse yourself. But please, if you don't have class, stick around. We'll do another 10, 15 minutes of Q&A, and then you can get off on your merry way. Thank you.
Let's do this. Hands up, because one of the other things about career development and creating opportunities for yourself is to always tell our kids, be proactive, put your hand up, ask a question, not a ridiculous question, but a challenging, appropriate question. Hands up, let's go. Who's got something for Bob Garrett? Yes, tell us who you are.
You got a mic? Yeah.
Only challenging, hard questions for
Oh,
Mr. Garrett.
yeah.
Go ahead.
I'll give you the hard ones.
Hello. Okay. So my name is Esmeralda Ignacio, and I was a part of the green teams here at Montclair State University for the PSCG Institute for Sustainability Studies.
Great.
And so I worked closely with Kyle Tafori, who is a part of your sustainability efforts
Kyle
at
asked you to
HMH.
say his name publicly.
No, no, of course not.
Where'd he go? He was just right here. Yeah.
Go ahead.
Shout out to him. And I wanted to ask, we personally helped with the electric vehicle sustainability efforts here for HME Hospital, but I wanted to ask personally, in the next 10 years, what goals or sustainability efforts do you see HMH accomplishing?
Well said. Go ahead, Bob.
That's great.
Sustainability.
Yeah, no, it's definitely a major focus for Hackensack Meridian Health. We are trying to reduce our carbon emissions by 50% by the year 2030, and really to go carbon neutral by the year 2050. So I told my team, I may not be the CEO by those years, but I'm coming back to making sure that's done. Because it is important. Listen, two reasons why I think it's so important for Hackensack Meridian. Number one, healthcare organizations, not just HMH, but across the world, happen to be some of the worst offenders out there when it comes to carbon emissions, just because of the nature of our business. So we have a responsibility to be good environmental stewards. And the other piece is it makes good business sense as well, right? It reduces in a lot of cases, it can reduce our energy bill, but also we have a responsibility to make our communities healthier. And I think that's what's most near and dear to my heart in reducing the carbon emissions, because we see the impact in our emergency rooms, in our hospitals, in our care sites. So the commitment is there, and those are our goals over the next few years, and then the goal up to 2050.
Great question. Come on, another question for Bob. Right back there. Gentleman right back there. Yes, tell us who you are.
Thank you, Mr. Steve, Mr. Garrett. My name's Clay. I'm a business administration finance major. I have a much tougher question. So the Commonwealth Fund recently did an analysis of America and 10 comparative countries. And in healthcare, we rank the worst in terms of outcome, in terms of how much money we spend through the public, but also with premiums and deductibles and everything else. And yet we don't even cover everybody. What do you say to people who look at a system like this and say, compared to other countries, it's barbaric and terrible?
That's a kind of a soft question, Bob.
Clay, thank you for that one, I
Clay.
guess. Yeah. No, seriously, some of the points you make are well taken. I would say this, that we can absolutely do a lot better.
We have to.
We have to do a lot better. And, one of the issues, I think, why the U.S. is spending more per capita on healthcare and not necessarily getting the best outcomes is that I don't think, unlike some of our neighbors out there in Europe, in Asia, and even in the North and South America, there's more of a focus in some of those countries on prevention. And I think that's been a real fault of the U.S. healthcare system. It's been about treatment. We don't spend enough time about prevention. We don't talk about, again, I talked a little bit about food and exercise before, talk about use of pharmaceuticals. We need to really have that conversation. At our medical school, one of the blessings of having a brand new medical school is that we can teach future physicians in a very innovative way. We have like a blank curriculum, and there's a really big focus on prevention. As an example, one of the requirements of our medical school is that medical students actually, through a course called Human Dimension, they pair up with families in underserved
They go in the
areas,
community.
and they go into the community and they follow these families, these individuals and families for 3 or 4 years. They understand very well firsthand why people are not staying healthy, why they might have a barrier to getting healthy foods. They might have a barrier because of transportation issues, getting
Social
to a
determinants of
primary
health.
care doctor. Really focused on the social determinants of health. So at HMH, we're doing our part. We have a big program on prevention. We have a big program on social determinants. As I said before, we're trying to hook up more New Jerseyans to primary care physicians because that's the first step in prevention. But we got a long ways to go, and I think, Clay, you make some really good points. But I think, hopefully, if there's a little bit more of a focus on prevention, we can start making a dent into the cost of healthcare and get better outcomes as a result of it.
Great question, Clay. Let's get someone over here. Yes, young lady over here. Tell us who you are.
Hello, my name is Siobhan Maynor. I'm an MBA student. I come here part-time. So my question is that some of us are a little bit mature students who are already in the career field for over 10 years. We decided to return back to school just to remain competitive. What is some advice that you could give some of us on how we could continue to climb up the corporate ladder as we maintain our current careers? And do you have any book suggestions for career development as well?
Bob, if you say read my book to fall asleep,
I was just going to say, Adebayo's
change.
book is the best. But
Say your first name again.
Siobhan,
Siobhan.
yes.
Thank you. Go ahead, Bob.
yeah, first of all, I think people who are in a career and they go back to school to really try to advance, I think should be shown a lot of respect in an organization. I think it's terrific. We try to encourage that the best we can. We have tuition reimbursement policies at HMH. We try to be proactive. I certainly absolutely believe, and I've seen it. I've seen team members start in one position, go back to school, and really advance within the organization. So it's something that I think should be celebrated as part of a corporate culture. And I think it also shows, it shows to me as a leader, it shows to me the drive, the motivation of somebody that they would make that sacrifice, because you're still working, and then you're trying to balance school with work. That's not easy, and maybe for some people also raising a family and doing all the other things that they're doing in their life. I mean, it is huge to be able to take that on. But I give a lot of credit to those people, and I would personally give them the benefit of the doubt in terms of promotions, in terms of career advancement. And we have a lot of leadership development programs at Hackensack Meridian Health, as an example. And there are people that go into those programs, do advance to other positions within the organization. So I really think education is important, whether it's within your organization, leadership development programs, or getting an advanced degree at a great school like Montclair. To me, those are the kinds of team members that I'd like to see continue to advance in the future.
Siobhan, can I just add something to what Bob just said? This expression, I didn't invent it, but it's not literally play in traffic, but play in traffic. Someone says, well, what does that mean? You know exactly what I mean. Be in the game. I often tell our son, he thinks someone's going to knock on the door and say, Chris, you're terrific. You should come to work for us. And I said, Chris, be out there. Introduce yourself, as you're doing right now. Play in traffic. Be in the mix. Introduce yourself and present yourself in a way which is hard to do in a digital platform, but meet people, shake their hand, old school, look them in the eye, start a conversation. Don't pitch yourself too hard, but be in traffic so that when and if an opportunity presents itself and they have your resume and you are somewhere in there. Hey, that's fine. She sounded terrific, and she's juggling all that. She could be a great team member. Playing traffic.
By the way, do you have your resume?
I do. I do.
We're
Just
gonna
send me
talk.
an
We're gonna
email.
talk.
That's what I'm talking about. Let's take, yes. Yes.
I'm a bit shy. I wrote it down.
Verbatim? What's your first name?
Chevy.
Chevy?
Hi, Sherry.
Thank you.
Please.
I'm an MBA student in finance and marketing. Okay. So given Hackensack Meridian Health's impressive growth and leadership position in New Jersey and beyond, I'm curious, how do you approach strategic partnerships and potential merger opportunities in such a competitive healthcare landscape?
Bob's not into mergers.
A great question, Sherry. And you know what? We started talking about at the beginning relationships, right? And relationships then can transcend into partnerships.
That's
They
right.
can transcend into mergers. And it's interesting. The healthcare landscape has changed. So there are healthcare systems that have gotten bigger, like Hackensack Meridian. And what's happened is it's hard for like a freestanding hospital, private hospital, to really survive in this environment. So it's natural that they would join a bigger healthcare system. You could say, people could argue, is that good or bad? I say for the most part, that's good, because that hospital, if it doesn't survive, what happens? The people in that community don't have the access to the healthcare that they had before. So if they become part of Hackensack Meridian and we can keep them continuing to serve their community, I think that's a good thing. But there are, in the healthcare space today, there are new players, aside from just hospitals and physicians. There's private equity firms that are owning hospitals, owning doctors' practices. There's CVS, Walgreens, all of them are in the healthcare space now. They weren't in there a few years ago. There's Amazon is in. And what I say, with all these new what they call them disruptors, but these new players in the market, I say my responsibility first is to look at how we could partner with them. There may be others that are out there say, okay, we got to compete with them. I first say, okay, let me call Walgreens, let me call Amazon, and we actually did call
You've
Amazon.
done that.
And there's a company that is under Amazon called One Medical. Maybe you've heard of them. One Medical, they are primary care physician offices. We partnered with them, so we have a exclusive partnership in New Jersey, and that helps to really provide primary care for more people in New Jersey. So first thing I look at is how we can partner. So some people call it frenemies, right? That old thing.
Sure.
They're your competitors, so they're kind of your enemies, so to speak. But I really look at them as more as potential friends, and that's been our philosophy, to try to partner, because I don't think we can do it all by ourselves. And whether we partner with them or somebody else partners with them, they're still here in our environment. So why not try to forge a good relationship and a partnership? So that's my philosophy, and we've been successful. Not always, but we've been successful in trying to partner with other players in the healthcare space, and they're not always hospitals. Like I said, some of these new players.
But and along those lines, Montclair State University could choose to look at every other institution of higher learning as a competitor, and they are on some level. But I live in the other end of town, and I remember giving a commencement speech at Bloomfield College about 15 years ago. There would not be an opportunity for those students who went to Bloomfield College to continue their higher ed education if it were not for Montclair State University. Translation: you can choose to see this zero sum, the pie is only so big, I got to get my piece. You can choose to do that, but in the end, collaborating, partnering, stepping up is good for Montclair State, but it also serves so many students who otherwise may not have an opportunity to do this. And that's the same spirit that Bob is sharing.
Love that question. Thank you.
One more. Yes, young man right here. Yes. We're getting paid tons of money. Tons.
We're
My
in
name's
overtime right
Liam.
now, right?
Yeah.
I'm
Please.
a business administration student.
What's your first
undergrad. Liam.
Liam, please.
My question was about the hospital you're building in Iselin. You said that you're going to have transit included. And as someone studying
This is not a question about fixing New Jersey Transit, is it?
No.
Is Bob, that's outside
It's
of the
actually
circle.
about how difficult it was to work with New Jersey Transit. As someone studying project management, that sounds really hard. And I also wanted to know if you were adding it to the North Jersey coastline or you were building your own line for it.
I love that question.
Do you really, Bob?
You just gave me like 3 or 4 different ideas, actually. Hello, Governor Murphy, right?
You are not responsible for New Jersey Transit, but
I'm
you're
looking for a
taking
job this
advantage
summer.
of the, what was that, Lee?
I said I'm looking for a job this summer if you need ideas.
So Liam, let me explain what we're doing. It's actually at the Metro Park train station.
Right.
And we're building what we think is the nation's first health and wellness center
is.
at a major transit hub. So it won't be an inpatient hospital. It will be all outpatient services, urgent care, medical services, surgical services, physicians' offices, cancer care. We're going to have a variety of services there. But it will give, if you think about it, will give patients and doctors and nurses and other providers unprecedented access because it's literally attached to the Metro Park train station. But I do love your idea about going up the transit line and maybe doing it at other stops. But we first want to make sure this one works. But we're going to open this actually by this time next year. It will start to open. And it was written up actually in some national publications because it is unique. It hasn't been done before. But think about it. It's kind of common sense. Like, why wouldn't you put healthcare services at transit hubs? I think they should be in airports too. There's no reason not to. So many people need that kind of access to care.
I want to do this because I also want to manage time. I know that we agreed a certain amount of time on would be sensitive to everyone else. Mr. President, would you like to share anything? Please.
I just wanted to say a big thank you before we close out, and I think you were going to offer to stick around to answer a couple.
Whatever anyone wants to do, absolutely.
So I just want to say a huge thank you to Bob and Steve for sharing. I hope, and as I can tell, because you're here, your eyes are big, you're listening. The one lesson I learned myself just by listening to both of you talk tonight. It made me think about my own practice as a leader, as a student, as somebody who's in the world. So I encourage you all to participate. I know some of you are but hopefully what that's doing is encouraging you to come and hear other voices you might not have heard. Because you heard a couple of people who, first of all, if you're in New Jersey and you don't know these two guys, your street cred is in question. So these are two people that everybody in New Jersey knows and everybody in New Jersey respects. But it's also a good lesson in the opportunity we always have to learn from something you hadn't really thought about, or maybe you have thought it, but it sounds a lot smarter coming out of somebody else's mouth than in your own head. So I just wanted to really thank you. I did have one question for you guys, because actually this thing about how many of you know what Medicare and Medicaid is? For those of you who don't, just because I think this is important, because it was about half. Because the part that I realize is we think everybody knows everything.
Right.
So Medicare and Medicaid are the two major federal programs that pay for health care for the poor or for the elderly. And these are major programs that prior to their existence, those two constituencies didn't get them. And the reason why those are major, simplify a little bit, but the reason why it's such a huge thing for Hackensack Meridian is, but for these federal programs that provide for that, it would be impossible for hospitals to treat those people and still be solid.
Right.
So I say that because the stuff that happens in the world, and I'm like the one guy that raised their hand for political stuff. But so the stuff that's getting talked about, like, it matters. So I just wanted to talk to that because it went by quickly, and I appreciated it, but I also sometimes think we don't explain our terms.
I think it's a great catch. And, I just heard a story recently, and I won't name the name, but it was somebody told me a story about a presidential candidate that didn't know the difference between Medicare and Medicaid. So I won't, no names, but the person who coached this presidential candidate said you can remember Medicare because care for the elderly, and Medicaid because of aid for the poor. So, I mean, that's just another kind of catching. And the presidential candidate said, "Wow, that's really, really good." So hopefully they understand it now. But you're absolutely right.
And that person is, never mind.
I'm not. No.
Okay.
I'm not.
I
going
didn't
there.
say anything. I did.
I'm not going there.
Just leave it alone.
Leave it alone.
Anyway,
Leave it alone.
round of applause. Thank you both.
Let me just,
Thank you, guys.
as Bob exits, let me just say this. I'm going to repeat what I said before, but a slightly different way. This is a great university with a tremendous and growing public reputation. Brand matters. Reputation matters. You have to bring it yourself, but you're coming from a place that people recognize. I cannot thank you enough for having us in your home at this extraordinary facility that, again, was not here back in the day. But I'm proud that it's here now, and this university is growing. I wish, particularly those of you graduating soon, all good things. And the challenges and the adversity you'll face moving forward, the grit, the Jersey grit. I'm old school from Newark, so we call it Newark grit as well. But there's a Jersey grit, and you need it because you get knocked down again and again. Montclair State University grit. You know what I'm talking about. And I'm looking forward to great success for all of you in the future. Give yourselves a round of applause. Bob, get your swag, and I'll take it from here.
All right. I need your book because I got to go to sleep.
Okay. Thank you, Bob.
Thanks, buddy.
Thank you. Thank you.
Great. Thank you, guys.
Anyone have anything? Leadership, business, whatever. I don't have all the answers. I usually ask questions. Yes, go.
Hi. Thank you so much for being here. I'm very impressed by you and even myself and my
Yes, I got this, Bob.
it's wonderful to meet you. Hi.
The president said I'm staying around, so I'm here. Mike is Bob's chief.